Hi, I'm Brittany Noble, the Noble Journalist. Thank you for joining me. With the coronavirus going around, I feel a duty to collect as much information as I possibly can to share with my community. So here's my update from New York. Here in Kings County, we have the largest cluster of coronavirus in the United States. In New York, we have a total of 173 cases. That includes an Uber driver. That includes 2 school bus drivers. About 100 of those cases are in New Rochelle, which is about a 30-minute drive from me here in Harlem. The governor is working to contain the virus in New Rochelle by using the National Guard. So they are out there cleaning or working to disinfect public spaces. They've shut down schools and religious organizations. The National Guard is even working to deliver food to everybody that is in that impacted area. One of the really cool things that I believe New York is doing right now is the governor has prisoners creating hand sanitizer. He says it smells like flowers. I haven't tested it yet myself, but I'm so appreciative of what the prisoners are doing to help make sure that people here in New York State stay safe. The coronavirus undoubtedly has become a pandemic because it has spread across multiple continents. In total, there's 117,000 known cases with 4,200 deaths. And of course, we're expecting that number to continue to rise. That's because 78 health labs all across the United States have been equipped with about 75,000 tests. And we know the more tests that we see, the more infections that we'll learn about. And the more people with access to the tests, the more numbers we will see. So how do we protect ourselves? Well, we're going to pay close attention to our symptoms and contact the doctor if you have a fever, cough, or shortness of breath. We're going to talk about the people that cannot contact the doctor in just a little bit, okay? Understand that the virus can spread through an infected person. If they cough, if they sneeze, it can be airborne. In my home, we are following the CDC's guidelines. We are working to stop the spread of germs, avoiding contact with people who are sick. We're not touching our faces. You can use a tissue to try to cover your cough, your sneeze. I myself, I'm not riding the subway. I'm limiting my contact even at work because I don't want to come around people that could have the virus not knowingly spreading it to other people. Okay, we've also created a plan in my home. The CDC suggests that you talk with your neighbors when creating a plan, identify organizations that may be able to help you, and then create an emergency contact list. Also plan for people who could be at serious risk. My mom is at serious risk. She's over 60 years old. My son is at serious risk because he has heart problems or he has breathing problems, right? And we have to be very, very careful what he comes in contact with. Now, here are my noble thoughts, y'all. I'm personally concerned about service workers like myself who do not have medical insurance and who are working hourly jobs just to survive. I'm especially concerned about the homeless population, especially here in New York City. The Coalition for the Homeless reports 63,000 people were homeless in New York late last year. They also report 22,000 homeless children. Many of them live in a shelter, but you can't even count the amount of people who live on the streets here, who live in the subway. And how do we stop them from getting sick? How do we stop them from potentially spreading disease? How do we stop the spread of coronavirus? So I want to know what you're doing at home to keep yourself, your family, your community safe. Drop your comments below. Share your noble thoughts. Thank you so much for joining me.